Good morning. I'm Dr. Jasmine Marcelin. I am an infectious disease physician at University of Nebraska Medical Center, as well as an assistant professor of medicine at UNMC, co-chair of Digital Innovation and Social Media Strategy for the Division of Infectious Diseases, and internal medicine associate program director of the internal medicine residency. This talk will achieve two main objectives. I hope to help you understand why social media is a tool for advocacy, and I'll help you to recognize some elements of a successful social media strategy. I'll use examples with real people to illustrate this, and end with some advice at the end from some people who do this particularly well. Now, it's important to understand that while everything we talk about applies to all platforms of social media, the framing is through the lens of Twitter, since this is the platform I use personally and professionally. So here are some of the top reasons I've had when I bring up using social media as a healthcare professional. I'll share with you that I myself was reluctant to join Twitter for many of those reasons before I understood how I could use it for my vision. So some of those examples are: I don't have enough time, it's mostly fluff, it's not really useful, how could I ever communicate meaningful information in so few words, and I don't really know anybody on social media, so what's the point? So there are a number of reasons why we should, as healthcare professionals, consider joining social media. But particularly in the middle of a pandemic, we see a need for multidisciplinary professionals to combat misinformation with real, reliable information for the public and for our colleagues. So this is my spin on a popular meme about how over the years, the people who the public turns to as experts for advice on how to deal with healthcare problems has evolved. Early on, the scientists were regarded as the experts, although in the past there was appreciably a lack of scientists of color whose voices were heard. The PhD student represents the hip, younger version of the scientists who can relate to the people better, but the journalists are real people who are supposed to be looking for details of the truth. Fast forward to the 2010s, and we see Karen on Facebook posting baseless health recommendations in Facebook groups, referencing Dr. Google as a source of information. And finally, my addition to the meme is where we are today, in the 2020s, with politicians who know nothing about healthcare delivery, treatment, or issues are driving pandemonium during a pandemic because of inappropriate recommendations in public forums. So where do we fit in as legitimate healthcare experts? What are our chances of being seen, especially if we are minorities in medicine? If you wondered whether or not you should give it a shot, this should be a driver for you to jump in and get your feet wet. You might still ask, however, what's in it for me? I love this figure by Chrétien et al., who conducted a qualitative study of the use of Twitter among medical students. The students they interviewed shared so many possibilities of the value of social media, and those benefits can be broadly broken down into finding and sharing your voice and access to the things and people that you need. Most importantly, on social media, you can find your people, communities, mentors, and collaborators. But this is all hypothetical, right? I mean, all this looks good, but what can it do for a real person? So I'm a real person, and let's just accept that by tuning into this workshop today, you can count me as a person you know. Here's a snapshot of the opportunities that I have had from Twitter alone that impact my professional development. This invited talk and many others on healthcare social media. I am currently the vice chair of the Digital Strategy Advisory Group at my Infectious Disease Society of America, co-director of Digital Innovation and Social Media Strategy, and the list goes on and on. And this does not even include the number of authentic friendships and communities that I have found as a result of this, including many of the people whose platforms I'll be sharing with you as examples of how to use social media for advocacy. So speaking of advocacy, what is advocacy anyway? The patient-first creed has been at the core of physician's practice throughout history. So in 2001, the American Medical Association House of Delegates actually approved an oath of professional responsibility that included the following words. We, the members of the world community of physicians, solemnly commit ourselves to advocate for social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. In today's digital age, especially during this COVID-19 pandemic, there is even a greater need for physician health advocacy because we have individuals and groups that are spreading misinformation and they have more influence and mobility through social media. So Dobson et al., whose paper I'm showing you here today, they propose that health advocacy should be divided into two broad categories. The first is agency, and that involves advancing the health of individual patients. So if you are calling the insurance companies on behalf of your one patient to get prior authorizations, if you are trying to figure out how to sort out their discharge planning and what that individual patient's social atmosphere is going to be like and how to help them, that is agency. Activism involves advancing the health of communities and a population or trying to change the system. So if you are speaking out for broader issues, if you are lobbying on the Hill, or if you are writing op-eds that are talking about different issues that affect patients as a whole. So many physicians might accept agency as part of the day-to-day job, but the activism part is more challenging because of time constraints, local politics, distance. Social media and digital technology can help cross those barriers, and the opportunities for physician advocacy are exponential. So why use social media as a tool for advocacy? Because it allows you to amplify your reach, connects you with like-minded advocates, facilitates cross-disciplinary, multi-institutional collaborations that will further help to amplify your advocacy efforts. How do you do it? First, you have to know what your mission is. Developing a personal statement will allow you to be more focused with your activities and also signals to others what your focus is so that you're not distracted by other people's visions. So on Twitter or any social media platform for that matter, you can create a succinct version of your personal mission statement in your profile. You can include your specialty if you already have one, your institution if you want, your passion, and any other pertinent information you want to communicate. Using a professional photo and cover image can also help to communicate what you're passionate about. So here are some examples of some colleagues who are clearly stating their missions in their profile. It's important to note that your profile does not have to be academic sounding. Dr. Punch's profile says trauma healer, Trini, Scottish, Polish, genderqueer. That clearly signals that Dr. Punch has surgical expertise, that information is coming from that Twitter account is going to be friendly towards immigrants and LGBTQ community. And she also lists her pronouns clearly. Dr. Essien, Strong, and Duma all use hashtags and other Twitter handles in their profiles, which means that whenever people search for those items, their profiles will come up in the search field also. So one final pro tip, generally, if you state in your profile that you are working or attending a particular institution, it's important to know that whether or not you state that your opinions are yours, you should conduct yourself in a professional manner that does not violate your institution's social media policy. And that should be your standard anyways. So here are some elements of a well-crafted tweet. Up front, you have your profile photo, and your handle. It's important to include hashtags for people to follow, and that also gives a sense of what exactly you're talking about, what is the general sphere or genre of what you're talking about. Tag people that you're identifying if they are on Twitter, like your colleagues or your authors or institutions. And that is, the reason for that is twofold. One, you can increase your reach and show people who you're affiliated with. But the other thing is that the people that you tag generally will amplify what you are tweeting about, and so that takes your message a lot further. So use icons for people to break up a little bit of some of the text, but don't use too many so that it becomes distracting. Photos will definitely increase the likelihood of more engagement. There is data that shows that including photos in tweets increases the engagement much more than having tweets with no photos. And then when I say engagement, I'm talking about the retweets, the likes, the comments. Those are the things on the bottom of the tweet. So generally speaking, if your tweets have some or most of these elements, you are well on your way to crafting great tweets. So let's take a look at how to actually do advocacy on social media. I adapted this concept from one of my good friends. And again, this is a friendship that started on Twitter, though we have yet to meet in person. And that's Dr. Avital Oglasser. So you can consider advocacy on social media to fall into 4 pillars or categories. You have patient or population advocacy, professional or society advocacy, personal advocacy, and then peer support or promotion advocacy. So in the next couple of slides, I will show you some examples of people who do this well. Doctors Onia and Uche Blackstock are 2 of my favorite people to follow on Twitter, and their handles are here on the slide for you to follow too. They're twin doctors who live in New York City. They have a consistent voice for patients, particularly vulnerable patients, standing up against inequity, bluntly calling out systemic racism in healthcare, and they are not afraid to use their platforms for this purpose. They do this well by tweeting in their authentic voices. You might see people disagree with what they have to say, but if you look at their responses, they are specific, they are data-driven, they are passionate, and they are authentic. In this kind of work, you could easily get drawn into arguments with people who only want to discredit you. And so we can really learn from Dr. Blackstock's example by really staying on message. And I think this has really helped to amplify their visibility in not only in social media, but also in popular press because they stay on message consistently. Students can also unveil inequities and dismantle racism too, and I wanted to make sure that I included examples of students who are doing this well as the faculty that I follow. And so one medical student who recently matched into residency is Crystal Nwora, and she consistently has messages of dismantling racism and revealing inequities. And a lot of what she talks about focuses on how some of our medical school training is flawed in that it does not allow us to have in the medical training enough understanding of the impacts that systemic racism and other factors have on society. One of my medical students that I'm mentoring, Rohan Kazanchi, he is another person who uses social media as a platform to discuss a lot of social determinants of health, and takes it beyond social media to advocate for vulnerable populations with the American Medical Association and other medical associations, but shows those things that he does on Twitter so that people are aware of some of the things that are happening in those organizations. And then another medical student, or actually not a medical student, a graduated physician from Haiti, Dr. Jonas Attalus. He is a very consistent voice on Twitter, talking about social determinants of health, how we can help people in minority populations, how we can help people who are vulnerable, people who are poor, and what public health really has to do with the practice of medicine. So these are just 3 examples of phenomenal trainees that we should be following who are doing social media advocacy well. When I think of patient and population advocacy, healthcare inequities and racism are not the only issues that fall into this category. There are healthcare professionals advocating for sensible gun laws, more widespread vaccination, abortion and women's health issues, sexual harassment, gender equity, smoking, vaping, a lot more. You don't have to be an advocate for all of these, and it's okay to limit your involvement to what you are comfortable speaking about. But know this, sometimes the very premise of advocacy requires speaking about things other people are uncomfortable about, and you have to be okay with that too. One of the beautiful things about social media advocacy is that it can be multi-dimensional. You can join Twitter to inspire people and end up being a voice for equality. And you can do this while being a respectable rapper medical student too. Meet Lash Nolan, a Fulbright scholar and Harvard Medical School's first Black woman class president.
It's Freestyle Friday, y'all. Look, you remember me. Lil' shawty with the flow from the CPT, and I'm reporting live from that quarantine, and I'm here to talk about PPE. Look, Trump, please listen to me alongside the mother MPs and MDs. If you don't, you're going down in history as a worst response to COVID-19. Current situation, let's take a look. 50,000 deaths, and it got me shook. Good leadership is all it took, but instead you deny the truth in science books. I heard we gotta wear masks, but we in the shortest. Where is the cash? My check, I'm still just waiting for that. No support for immigrants, what's up with that? You know I got that trooper flow. If you didn't know, then now you know. No shaking hands, just throwing bows. Tell the president to stop playing, bro.
I love that. So just as Lash Nolan joined Twitter to inspire others, it can be a means for professional advocacy, especially if your profession is not representative of the population it serves, or if leadership in your profession is not including the voices that need to be heard. Dr. Quinn Capers IV is another advocate on Twitter. A couple years ago, Dr. Capers and a few other physician colleagues had a conversation on Twitter about the lack of representation of Black men in medicine and needing to show positive images of Black men to change the narrative. And from that conversation, Black Men in Medicine movement was born. The Latinas in Medicine hashtag, created by Drs. Narjas Dumas and Maria Mora Pinzon and double doc student Brianna Ruiz Christophers, was born out of the similar necessity to provide a common space and grace to share experiences, amplify Latinas in healthcare professions, and inspiration to show people that Latinas can be amazing medical doctors. These movements promoting diversity and equity in medicine have taken on lives of their own, resulting in increased visibility of minority physicians and their missions. Doctors Balzora and Gray use the diversity in GI movement to not only promote diversity within their specialty of gastroenterology, but to take that advocacy back to the patients and population to promote colorectal cancer screening in the African American community. This movement is saving lives. These 2 doctors gave some advice to you about using social media advocacy up on the screen, and you'll see themes circling back through: passion, professional development, authenticity, amplification, and inspiration. It's not just racial ethnic minorities who can advocate for the profession. Doctors with disabilities, LGBTQ doctors, immigrant doctors, women in medicine, all have active movements to uplift members of those communities and provide evidence to the wider world that they matter, that their voices matter, and that they can change the world. So how to make sure your message is being heard? Share your data supporting your platform using links and images. Incorporate pertinent hashtags and share mixed media content. All of these will increase visibility and reach of your message. Peer promotion advocacy is unique because I see it as an opportunity for people who have privilege to become allies or upstanders. Stand up and recognize others for their potential and for their expertise and for their efforts. Doctors Esther Chu and Carlos Del Rio both do this really well, and both have used their platforms to elevate me personally, resulting in many opportunities that I wouldn't have had otherwise. This is called sponsorship. Okay, now we're going to talk about something people are not very comfortable about, self-promotion. I don't mean in the braggy, obnoxious way, but it is really important for us to be able to advocate for ourselves, even if it makes us uncomfortable. It's okay to share successes. It's okay to talk about yourself sometimes. Be authentic when you do. And if you are super uncomfortable with it, chat with a near peer to promote and advocate for each other. Dr. Kimberly Manning is one of my heroes and friends and mentors, again, whom I have not met in real life, but have connected with Twitter and spoken on the phone and FaceTime. And when she posted that she was promoted to professor and that there are only 270 Black women with this rank in the United States, I was ecstatic. For her, yes, of course, but I also saw her post as a call and a reminder that I can do it too. So your posts promoting your awards, your scholarships, your promotion, your residency, and all that stuff can reach people beyond your knowledge and maybe the inspiration that someone out there needs to just go get it. Personal advocacy is not just about career promotion, however. I follow Dr. Riordan Ledgerwood and Matthew Cortland's profiles because they're both fearless warriors for their communities. Dr. Ledgerwood's feed is filled with posts about what it is like to be a trans doctor, what the transition was like, and how people around them responded to changing pronouns, changing name. And that authenticity is sorely needed for both other trans doctors or med students or others to know that they are not alone, but also for those of us who are not in the LGBTQ+ community to hear and learn. Matthew Cortland has openly shared his experiences with chronic illness, connecting with the disability community and educating everyone about the issues that matter to the disability community. Personal advocacy is not just about you. Think about all of the other people that you might be impacting, that you may be speaking for, that you may be helping to give that voice besides just yourself. And finally, it's okay to have fun. Don't take yourself so seriously all the time. Even having fun can be a part of the mission. When you are trying to inspire people to go into a field, you have to show them how much you love it. And Dr. Jason Campbell does this really well.
Now left foot, right foot, now left foot, right foot, now left foot, right foot, now left foot. One hand, two hands, hit your rollie, do your dance, now lean with it, rock with it, lean with it, rock with it.
Okay, so I enjoyed sharing these amazing people and their platforms with you and hope that you follow all of them on Twitter. Now I want to move into some tools and concrete examples of how your mission and vision can interact with your advocacy goals on social media. People need to know who you are, so your name shows up in their mental contact list when they're looking for experts. So it's important to think about that advocacy and that vision and mission as your why, who, how, when, what. So are you on social, as far as the why, are you on social media for personal or professional reasons or both? What are your goals? Is it to connect with thought leaders, to collaborate with colleagues, to expand your knowledge? My social media why, professional use mostly. I do want to collaborate and connect with other people. I do want to learn more. Who are you trying to reach? People within your specialty or your sphere, or people outside of your comfort zone, or potential patients, or all of the above? Do you want to have conversations with peers or make connections with others? And again, for my who, my audience is everyone. I speak this in the same voice to everyone because the message that I want to share has an implication for everyone around me. How do you want people to know you? What is the voice they want you to know you want them to know you for? I share things authentically only because I want to make sure that I am who I am on social media as well as in person, and that's the same person. I caution against creating a social media persona that is different from who you really are, because people can kind of smell when somebody is being fake. When I also think I want you to think carefully about when you are posting what you are posting about. Caution against jumping onto popular trending topics that you're not familiar with or you're not an expert in just because they're trending. Um, you want to make sure that you are posting about what is your brand all the time, and jumping into things that you are not as uh, good at navigating, you may appear inauthentic, and that could negatively affect your brand. And then what's your bottom line? What's your platform? My social media purpose is to speak up for minorities in medicine, against disparities and implicit bias, share expertise about infectious diseases and antimicrobial stewardship. My what is that healthcare needs to be diverse. The end. So that is what I will always be posting about, whether or not that thread goes through infectious disease, about general medicine, about recruiting, about antimicrobial stewardship. There will always be a thread of healthcare needs to be diverse. It's important to note that your mission and your vision does not or should not include the follower counts and verified check marks and other superficial measures of relevance. It should really focus on those goals and values. Dr. Tom Varghese Jr. coined the I4 framework for social media strategy. And I think this applies whether your goal is advocacy, professional development, collaboration, or even promoting your research. Create your posts based on your personal values, not based on what's trending. Engage with meaningful interactions. The inspiration of your posts and meaningful interactions will help you to become an influencer if you do those first two things meaningfully and regularly. And then finally, the impact of this influencing should be more important than the number of followers. And you'll find that if you approach all of your interactions with I4 in mind, then eventually you will still increase your followers. But as you increase those followers, you increase your visibility, and social media is not all sunshine and unicorns and roses. A couple of cautionary tips to remember. Everything on social media is permanent. People can take screenshots. And so you want to make sure that the things that you're saying are things that you would be okay with screenshots being sent out to your family, to your boss, to your program director, to your dean, etc. Remember, again, with any sort of impersonal communication, just like texts or emails, social media also has a lack of context and sometimes difficulty in perceiving what a person's tone is, and your ability to explain what you mean are maybe a little bit limited. And so again, try to be very clear in what you are communicating to reduce the possibility of being misunderstood. There are trolls on Twitter and there are bots on Twitter. And these are individuals who are really not trying to help to further positive discussions, but a lot of negative energy and trying to discredit you. You have a couple different options in terms of how to respond to negative tweets. You can ignore. You can challenge or argue, but again, be careful because sometimes, especially for bots, there's not a lot of thinking that is going into the argumentative responses that you may be getting towards what you're saying, and so you may be going down a rabbit hole that you don't need to go down. You could apologize and make a resolution if it is something that you have done incorrectly. And I think it's important to recognize that we're all human, we're not perfect. And if you said something wrong, it's appropriate for you to apologize for that. Or you can directly message somebody if they appear to be genuinely concerned with what you said, and their goal of refuting what you talked about is more for education. You can have a direct message conversation with these people, and I've found when I've done that, there's a lot of things that have been resolved. It's important to choose your battles and stake your platform. With every potential controversial discussion, you have to decide on if this is the hill that you're willing to die on. And again, that goes back to what are your values, what are your goals, and what is the consistent message that you want to be sharing. So there are a lot of benefits to using social media for advocacy and some pitfalls you need to be aware of. I would say that the benefits definitely outweigh the risks, but don't just take my word for it. I asked my friends on Twitter what their must include messages would be to you in this workshop, and here's what they said. You'll see multiple themes here as you read through their responses. You can use Twitter successfully for advocacy. And I gave some examples of individuals at varying stages in their medical careers, from medical students to residents to attendings, and their success and advice boils down to 7 core tips. Be authentic. Stay positive. Stay connected. Advocate for yourself. Focus on your mission and goal. Advance the science and support others. There will be some time to take a few questions, and I want to end by saying that these are the faces of advocacy on social media. Each face, each hashtag is important, and together the movements are unstoppable. Thank you.